We're coming to you from EHA 2018. It is Friday. I'm Blake Morrison. I'm here with Karim Iskander, who is with Amgen as the Executive Director for Global Medical Affairs and is responsible for the activities associated with Kyprolis, their second-generation proteasome inhibitor. And Karim, I understand that both here at EHA, but also at ASCO, that you have presented some really interesting new data with Kyprolis around an alternative dosing schedule for that compound. What can you tell us about it, please?
Sure, exactly, Blake. As you know, Kyprolis improved survival in 2 phase 3 studies in relapsed multiple myeloma. One using the KD regimen and one KRD. However, both those studies were twice weekly dosing, so patients received Kyprolis 2 days in a row, 3 weeks on, 1 week off. Focusing now on the patient experience and how to improve further quality of life for those patients, Amgen invested in a randomized phase 3 study comparing a once-weekly regimen, KD at 70 milligram per meter square, with a twice-weekly KD 27 milligram per meter square. And the results of those studies were presented at ASCO by Professor Maravi Mateos, demonstrating that the once-weekly 70 is not only more convenient for patients, but also improved response rate and progression-free survival compared to the twice-weekly at 27, and with comparable safety profile and no surprises, particularly from safety. Well tolerated and offering a potential new regimen that is more scheduled and patient-friendly.
Well, that's progress in the right direction, certainly for Kyprolis. And is the study still ongoing? Is it looking at an overall survival endpoint, or was progression-free survival the primary?
The primary endpoint is progression-free survival. The study is still ongoing, so we may get further follow-up. We did also present the interim OS. It's still immature, but showing a slight positive trend directionally in the direction we would hope for with the weekly dosing.
That's very exciting. So what else is going on here at EHA for you? It's certainly a busy time for Amgen and a product that has a lot of studies going on, so there must be some other exciting data.
Sure. So additional weekly data has been presented at ASCO and also being presented here. One of the key ones is the addition of daratumumab, the monoclonal antibody, to that regimen that was in the A.R.R.O.W study. So KD 70 plus daratumumab, and it's well tolerated. The response rate and the PFS is very promising, particularly in the unmet need of lenalidomide refractory patients. As you know, there is a growing utility of lenalidomide in frontline, and the subgroup analysis in this patient were presented and showing PFS of 14.1 months, which is better than any other data for this patient population.
So what has been the response from the treating community about these new data?
They are very excited, especially that they have been asking for weekly data for a long time, and now not only showing, we have demonstrated phase 2 data before, but now having phase 3 superiority with weekly dosing really establish a very good option moving forward. And for Kyprolis, all our future development will be focused on weekly, whether in doublets or in triplets.
Stole the question right out of my mouth. So that's fantastic. Well, congratulations on the great data, and we'll look forward to seeing that continue to mature. And we'll have you back to talk about the future of Kyprolis as a weekly regimen.
It will be my pleasure. Thank you, Blake.
Thank you.